Before we start, quick honest disclaimer. I'm not a doctor. I'm a researcher and content creator who spent a lot of hours this week in medical journals and case studies trying to answer one specific question. If you've had vertigo treated, successfully treated, room stops spinning, you feel like a new person. Why does it sometimes just come back? Weeks later, months later, same feeling, same panic, same, wait, didn't I already deal with this? If that's happened to you, stick around, because what I found in the research surprised me. It's not really about the treatment failing. It's about something happening underneath the treatment that almost nobody explains to patients. Let's get into it, what we're actually talking about. First, a quick reality check on terminology, because vertigo gets used as a catch-all word for a bunch of different things: lightheadedness, feeling faint, general dizziness. The specific kind of vertigo most people are dealing with when they say, "The room was spinning and it happened again when I rolled over in bed," has a name: Benign Paroxysmal Positional Vertigo, or BPPV for short. Multiple sources describe BPPV as the most common cause of recurring vertigo and the most common inner ear balance disorder doctors see. It's the type where sudden, intense spinning gets triggered by a change in head position, rolling over in bed, tipping your head back to look up at a shelf, bending down to tie your shoe. The episode is usually brief, often under a minute, but it can feel terrifying while it's happening. Here's the mechanism, in plain terms. Inside your inner ear, you have tiny crystals made of calcium carbonate. Researchers sometimes call them otoconia, or more casually, ear rocks. Normally, these sit in a specific structure called the utricle, where they help your brain sense gravity and linear movement. But sometimes they come loose and drift into one of the nearby semicircular canals, the fluid-filled loops that sense rotation. Once they're in there, they don't belong, and they make that canal wildly oversensitive to head movement. Move your head, the crystals shift, the fluid sloshes, and your brain gets a signal that says you are spinning when you're not. That mismatch between what your inner ear says and what your eyes and body say is what creates that sickening spinning sensation. The standard treatment is a set of specific head and body movements designed to guide those stray crystals back out of the canal and into the part of the ear where they're supposed to be. You've probably heard of the Epley maneuver, that's the most well-known one, but there are a few variations like the Seamont maneuver or the BBQ roll, depending on which canal is affected. A doctor, physical therapist, or audiologist typically performs this in a few minutes in office, and for a lot of people, it works dramatically fast. Some people feel the improvement within that single visit. So here's the part that confuses people. If the maneuver worked, if the crystals really did move back to where they belong, why does it come back? The maneuver isn't the whole story. This is the key reframe I want you to sit with for a second. The repositioning maneuver treats the crystals that are currently misplaced. It's mechanical, physical, almost like resetting a jammed drawer. What it does not do is answer the question of why crystals came loose from their normal spot in the first place. If whatever caused that initial displacement is still active in your body, there's nothing stopping a fresh batch of otoconia from breaking loose again next month or next year. That's really the heart of why vertigo keeps returning. It's less about the treatment failing and more about an underlying process quietly continuing after the symptoms are gone. So what does the research say actually causes crystals to come loose in the first place? And more specifically, what predicts whether it's going to happen again? I want to be upfront. Researchers themselves say the exact cause of otoconia dislodging in most cases isn't fully understood. This isn't a solved mystery, but across a number of separate studies, several consistent risk factors keep showing up for both getting BPPV and having it recur. These include older age, being female, high blood pressure, diabetes, high cholesterol or other lipid abnormalities, migraine history, head trauma, low bone density conditions like osteopenia or osteoporosis, and low vitamin D levels. Multiple independent research teams, looking at different patient populations in different countries, have landed on overlapping versions of this same list. Now, some of those, like age and being female, aren't things you can change. But a few of them are, and one in particular has become the focus of a genuinely interesting and still unfolding area of research: vitamin D and bone metabolism. The vitamin D connection, what the evidence actually shows. Here's where I want to slow down, because this is exactly the kind of topic where content online loves to oversimplify into take vitamin D and your vertigo is cured forever. That is not what the research says, and I'm not going to pretend otherwise. Let's walk through it carefully. The logic behind the vitamin D theory starts with basic biology. Those otoconia crystals in your inner ear are made of calcium carbonate, essentially the same category of mineral compound you'd find in bone. Vitamin D's central job in the body is regulating calcium, how much you absorb, how it's used, how it's deposited and maintained in tissue. Researchers have reasoned that if vitamin D is deficient, the metabolism of calcium-based structures throughout the body, including in bone and, theoretically, in the inner ear, could be disrupted. If that's true, low vitamin D could make otoconia structurally less stable, more prone to breaking off from where they belong. That's the theory. Now, what has actually been measured? Several individual studies have compared vitamin D blood levels between people whose BPPV kept recurring and people whose BPPV did not come back. One such study found that the group with recurring BPPV had noticeably lower average vitamin D levels than the non-recurrent group, and the difference was statistically significant. I want to flag something important here, though. The same study explicitly reported that while the difference was statistically meaningful, the actual clinical effect size was small. That's a distinction that matters. Statistically significant tells you the pattern probably isn't due to random chance, but it doesn't automatically tell you the effect is large or dramatic in real-world terms. Both things can be true at once, and this is one of those cases. A separate study, this one following patients in Singapore, found that people with higher vitamin D levels were meaningfully less likely to have their BPPV come back, based on a statistical model that adjusted for other factors. Again, this is one study from one patient population, and I'm not going to inflate it into a universal law. Here's where it gets more honest and more interesting, though. When researchers pulled together a broader review of the existing studies on vitamin D and BPPV, a review that specifically dug through PubMed, Embase, and other research databases, they found something worth sitting with. Earlier studies did not find a link between low vitamin D and someone's very first BPPV episode. The link that kept showing up was specifically with recurrence, or it's people who already had BPPV and then had it come back. That's an important nuance. Vitamin D research here isn't necessarily saying low vitamin D causes vertigo. It's saying something closer to, among people who already have this condition, lower vitamin D is associated with a higher chance it returns. And even that more specific claim isn't unanimous. A separate study out of China, looking specifically at older patients, explicitly stated that a few other studies did not find an association between vitamin D and BPPV occurrence or recurrence at all, and concluded that the relationship remains, in their words, debatable. A more recent systematic review and meta-analysis, essentially a large-scale attempt to combine numbers across many studies to get a clearer overall signal, confirmed there is an association worth taking seriously, but also explicitly acknowledged that individual study results have been inconsistent. So where does that leave us? Somewhere in the middle. And I think that's actually the honest, useful answer rather than an unsatisfying one. The evidence leans toward vitamin D deficiency being a real contributing risk factor for BPPV recurrence, not the sole cause, and not something universally agreed upon in every single study, but a pattern that keeps showing up often enough across independent research groups that it's taken seriously in the field. It is not settled science. If a video tells you doctors have proven low vitamin D causes vertigo, that's overstating what's actually in the literature, the bone connection. While we're here, there's a related thread worth mentioning: bone density. A few studies have specifically looked at whether people with BPPV are more likely to also have osteoporosis, or low bone mineral density, and vice versa. One review of this research described an association running in both directions, people with BPPV showing somewhat higher odds of also having osteoporosis, and people with osteoporosis showing somewhat higher odds of also having BPPV. I want to flag that this particular figure comes from a review summarizing an earlier study's findings, rather than something I independently verified in a primary data set. So treat it as a described association rather than an airtight number. The proposed reasoning connects back to the same idea as vitamin D, calcium metabolism. Bone remodeling and otoconia maintenance may rely on some of the same regulatory pathways, so a body that's struggling to maintain healthy bone density might also be struggling to maintain the structural integrity of those inner ear crystals. It's a plausible, biologically coherent theory. It is still a working theory, not a proven mechanism. Does taking vitamin D actually reduce recurrence? This is obviously the question everyone actually wants answered, so let's look at what's been tested. A small case control study out of Egypt split BPPV patients into two groups after they'd already had standard repositioning treatment. One group also received vitamin D supplementation, the other didn't. I want to be very clear about scale here. This involved a small number of patients, 20 per group, tracked over 6 months. Within that small trial, the group receiving vitamin D reportedly had fewer recurrent episodes. That is a genuinely interesting early signal. It is also, by definition, a small preliminary study, and small studies are exactly the kind of thing that can look promising and then fail to hold up once tested on larger groups. Zooming out, the broader review I mentioned earlier, the one pulling together multiple studies on vitamin D and BPPV, reported that across the trials they reviewed, vitamin D supplementation in patients who were deficient or insufficient appeared to reduce both the number of people who relapsed and the number of relapses per patient. But, and this is a direct reflection of what that review itself said, the authors called for larger, randomized controlled studies with bigger patient groups and longer follow-up before this can be considered confirmed. That's the researchers themselves saying promising, not proven. There's also a registered clinical trial specifically designed to test this question properly, a randomized, placebo-controlled study looking at whether vitamin D supplementation reduces BPPV recurrence in older adults. That's exactly the kind of rigorous design that could settle this question. As of what I could find, results from that specific trial registry listing weren't clearly available to review, so I'm not going to claim an outcome I haven't actually seen. A related, more recently published randomized trial in older adults ran into its own limitations. Some of the follow-up data the researchers had planned to collect ended up missing, which limited what conclusions they could draw. Real research is messy like that, and I'd rather tell you that than pretend the picture is cleaner than it is. So, bottom line on supplementation, there's a real biologically plausible and moderately supported reason to think that correcting a vitamin D deficiency might help reduce how often BPPV comes back, especially in older adults or people who are already known to be deficient. But this is early to moderate stage evidence, not a settled guideline-level recommendation that everyone with vertigo should be popping vitamin D. And critically, vitamin D isn't a treatment for an active episode. It's not going to stop a spinning episode happening right now. At best, based on current research, it may play a role in prevention over time for a specific subset of people who are actually deficient. Quick pause. Check in with yourself. Let's do something a little different for a second. I want you to think back through that list of recurrence risk factors I mentioned earlier. Age over 50 or so, being female, high blood pressure, diabetes, high cholesterol, migraines, a head injury at some point, low bone density, or a known vitamin D deficiency. Mentally count how many of those apply to you or someone you're thinking of while watching this. If you land on 0 or 1, your vertigo returning might genuinely be more about the mechanical side of things. Maybe the maneuver didn't fully clear the crystals the first time, or a new dislodging event just happened again by chance. If you're sitting there counting 3, 4, 5 of these up, That's not a diagnosis, and it's absolutely not something to panic about, but it is useful information. It's a reason to have a real conversation with a doctor about testing, rather than just repeating the maneuver every time symptoms show up and hoping it eventually stops. Drop where you landed in the comments if you want. I'm curious how common the overlap is, and it might help other people watching this see they're not the only ones dealing with a cluster of these factors at once. Why this actually matters beyond the annoyance, I want to take a second to talk about why just live with it coming back isn't a great long-term plan beyond the obvious misery of the spinning itself. A large nationwide cohort study out of Taiwan, tracking tens of thousands of people diagnosed with BPPV against a matched group without it, found that people with BPPV had a meaningfully higher risk of subsequent injuries over time compared to people without the condition. The kind of injuries you'd expect from sudden loss of balance, like falls. I'll be direct that this is a single large study, and I haven't found a second study replicating that exact number, so treat the specific size of the increased risk as coming from this one dataset rather than an independently confirmed universal figure. But the underlying logic doesn't need a second study to make sense. If your balance can unpredictably fail for a few seconds while you're on a ladder, driving, or walking downstairs, that's a real safety issue, not just a quality of life inconvenience. That same study also noted that standard treatment only modestly reduced this injury risk, which is honestly one more piece of evidence that treating the immediate episode isn't the same as addressing everything going on. Beyond physical injury, research reviewing quality of life data in BPPV patients has found consistent effects on daily functioning, mood, and even social withdrawal. People avoiding activities, avoiding leaving the house, developing anxiety around normal head movements purely because they're afraid of triggering another episode. If you felt that fear creeping in, the hesitance before you roll over in bed, the bracing before you look up at a top shelf, that's a documented, recognized part of what this condition does to people, not something you're imagining or overreacting to. So how do you actually try to stop it from coming back? Given everything we've just walked through, here's what a genuinely evidence-informed approach looks like. I'm going to keep this grounded in what the research actually supports, not turn it into a miracle checklist. First, get a proper diagnosis and get the repositioning maneuver done correctly, ideally by someone experienced. A doctor, an ENT, an audiologist, or a vestibular physical therapist. If your vertigo returns quickly, one real possibility is simply that the initial repositioning wasn't fully completed, or there's more than one canal involved than was initially treated. That's a mechanical issue, and the fix is mechanical. Go back and get it properly reassessed, rather than assuming something more complicated is going on. Second, and this is the part tied to everything we just covered, if BPPV keeps recurring not just once, but as a pattern over months, that's a reasonable moment to ask your doctor about checking your vitamin D levels through a simple blood test. This is genuinely worth raising as a specific question, given how consistently it shows up across the research we just went through, even with the mixed findings. If a deficiency turns up, your doctor can guide you on whether and how to correct it. I'm not going to tell you a dose here because appropriate vitamin D supplementation depends on your current levels, your kidney function, other medications, and other health conditions. And vitamin D is not something to just self-dose in large amounts, since too much can cause its own problems, including issues with calcium levels in the blood. This is exactly the kind of thing to run past your doctor first, especially if you're on blood pressure medication, heart medication, or medication for any chronic condition, since interactions and appropriate dosing really do vary person to person. Third, look at the other risk factors on that list that are at least partially manageable: blood pressure, blood sugar, cholesterol. None of these were shown to be a magic fix for vertigo specifically, but they're consistently associated with BPPV risk across multiple studies, and managing them is something your doctor is likely already encouraging you to do for a dozen other health reasons anyway. This isn't a stretch recommendation, it's just connecting dots that were already there. Fourth, and this one is more about safety than about stopping recurrence. Take the fall and injury risk seriously while you're dealing with an active or recurring BPPV pattern. That might mean being more careful on ladders, being cautious with sudden head movements while driving, or simply giving yourself a beat before standing up quickly. Given what that large cohort study found about injury risk, this isn't overly cautious advice. It's a genuinely practical response to a documented risk. And finally, if your vertigo doesn't fit the classic BPPV pattern, if it lasts much longer than a minute, if it's accompanied by things like hearing loss, severe headache, slurred speech, weakness, or double vision, that's a signal to get seen urgently rather than trying repositioning maneuvers at home, because a small number of vertigo cases stem from something other than displaced ear crystals, and those need a different kind of evaluation entirely. Wrapping this up, here's what I want you to walk away with. The reason vertigo keeps returning usually isn't that the treatment didn't work. The maneuver almost certainly did exactly what it's designed to do. It moved crystals that were already loose back where they belong. The more likely explanation for a pattern of recurrence is that something in the body keeps creating the conditions for new crystals to come loose in the first place, and vitamin D and bone metabolism are among the most actively researched, most plausible pieces of that puzzle right now, alongside things like age, blood pressure, blood sugar, cholesterol, and migraine history. None of this is settled science with a bow on it. Some studies find a strong signal, some find a weak one, and at least a few find none at all. That inconsistency isn't a reason to dismiss the research. It's just what real, ongoing science looks like before a bigger, more definitive trial comes along and gives us a clearer answer. What you can do, right now, is bring an informed question to your doctor instead of just quietly repeating the same cycle every time it comes back. Get the maneuver done properly, ask about a vitamin D check, and look at the broader picture of your health rather than treating each episode as an isolated, unrelated event. If this helped make sense of something that's been frustrating and honestly a little scary for you, consider subscribing. I'm continuing to dig through the actual research on conditions like this instead of just repeating whatever's already circulating online, and I'd rather get it right and be upfront about the uncertainty than promise you something the studies don't back up. Take care of yourself, and I'll see you in the next one.